PoTS stands for Postural Tachycardia Syndrome.
PoTS is a long-term, sometimes quite disabling health condition.
I have a faulty nervous system, so a lot of my organs have issues kind of keeping up. I especially get symptoms when I stand up.
The commonest symptoms of PoTS are heart palpitations, lightheadedness and fatigue.
When we're talking about PoTS, it's defined on the basis of a heart rate increase, and it presents with heart symptoms, and so it's often seen by cardiologists. It isn't, however, a heart problem. So when you look at the heart, there isn't a structural problem with the heart.
If they do a scan or an X-ray of your chest and it's healthy, then you're just dismissed as kind of overreacting to what's going on. For me, the worst symptom is kind of whatever I'm experiencing at that moment. So it could be the fast heart rate, could be the brain fog. Other days I'd feel completely weak and like I'm going to faint, or nausea.
A lot of people think that everyone with PoTS faints, but in fact, you don't have to faint to be diagnosed with PoTS.
I have fainted before, but I haven't in years. But I've still had a lot of other PoTS symptoms in that time.
A lot of people think that PoTS is rare, but in fact it's likely to be quite common.
I grew up on a road with 3 other girls who'd actually developed PoTS at the same age as me.
It's often mistaken for anxiety, and because patients don't die of PoTS, it's then ignored because it's not life-threatening, so therefore why should we be interested?
Yeah, I remember when I first started getting symptoms, I went to my GP who said, oh, that's quite normal to feel faint and lightheaded sometimes. And I think from the time that I first felt the kind of PoTS lightheadedness to when I was diagnosed was about 12 years.
I actually had ME, or chronic fatigue syndrome as it's known. My opinion is that PoTS is very different to ME because I still live with PoTS and it feels very different. Similar, but different to ME.
We find that a lot of people have a label of chronic fatigue syndrome and then they later find out that what they actually have is PoTS. But also there are a number of people who seem to have PoTS and chronic fatigue syndrome. PoTS is sometimes described as an invisible illness, and that means that patients often look reasonably well and aren't obviously unwell, even though they can be experiencing considerable disability.
I had a blue badge for the car, and I also had a wheelchair because I couldn't even walk to the toilets. And I remember going with my mum to the local shop, and people started being quite rude to us that we had a blue badge and why was I in a wheelchair.
Someone will come up to me and say something like, do you know that's the disabled seat you're sitting in? And at that point, I'm like, it's a seat. I don't really care. It's better than being on the floor.
Fortunately, PoTS isn't life-threatening. Now, clearly, that doesn't mean that it can't be life-altering, and we know how it can affect our patients and have so many widespread effects on education and jobs and family life.
There were lots of things that I was misdiagnosed with, and also some things that the doctors thought it could be that they were testing for, and some of those can be really harmful. If you've got symptoms, you should definitely go to your doctor because it could be something else.
There is no current cure for PoTS, unfortunately, but there are certainly many things that we can do.
It's important to maintain a good fluid intake.
There are lots of different medicines.
A lot of patients are advised to have extra salt.
Compression clothing, maintaining fitness.
Sometimes people find that manipulating their diet can be helpful.
I think that's one of the biggest things, is learning your body and how it reacts and what might trigger you, what might help you.
Some people think that PoTS is due to deconditioning. However, a lot of people are exercising quite regularly before they get PoTS. Doing a very graduated exercise regime can be very useful in improving the symptoms of PoTS.
I remember even at my worst, a physio got me to just lift 2 water bottles. And that was enough for then, because that began to get into my mind that I did need to actually move my body a little bit.
I'm quite lucky. I'm able to do quite a bit of exercise. And I find now that that makes me stronger and more able to do other things in my life.
I definitely don't think that people with PoTS don't like socialising, because more than anything we want to be normal and we want to be like everyone else.
Certainly there are times for most people with PoTS we're able to do more, but when we can't, it's really helpful when friends and family are a bit understanding that can vary.
You can push yourself and make yourself more unwell by going to things that will trigger your symptoms. And I've had to learn over the years what to say yes to and what to say no to. It's not that we don't want to socialise, it's just that we know our limitations sometimes.
I say absolutely, there is definitely hope, because I think a lot of people do find ways to manage or even alleviate a lot of symptoms over time.
I found it really great getting to know other people with PoTS. For a long time I didn't know anyone with PoTS, and it was so exciting to meet my first other PoTSies. And yeah, I think having a community of people who know what it's like is so valuable.
PoTS UK is the national charity that helps PoTS patients set up by medical professionals who have great expertise and understanding in PoTS.
There's lots of research happening, and we're really quite positive that there is hope that we'll understand PoTS a lot better in the future, and that patients will be better supported.